what is the difference between nutritional ketosis and optimal ketosis, right? So we hear about all of these different terms for ketosis: nutritional, optimal. You will also hear therapeutic and maybe some other ones that I haven't mentioned. But nutritional ketosis is really just when your body starts producing a sustainable amount of ketones in the body, and we usually see this at 0.6 millimoles per liter as measured in your blood, right? So 0.6, anywhere up to around 2.5, which is actually fairly high for nutritional ketosis. Above that, 2.5, or maybe starting at 3 to around 5 millimoles per liter, is what we would consider something like therapeutic levels of ketosis. And then 5 to 7, you might even find when you are doing a longer fast. I reached 7.2 millimoles per liter about a week into a fast. That's the highest I've ever been. And I can't say that there was any really great difference between 2.5 millimoles per liter and 6 millimoles per liter. I didn't really feel all that much different. It's just that my body is producing or is burning through more stored body fat and is becoming more fat adapted, so I'm able to produce more ketones to use as fuel. Higher levels don't necessarily lead to additional weight loss. If it does, it's probably not something that's easily measured. Higher levels are typically desired if you are using ketone or ketosis to treat some kind of a disorder, disease. We'll see there's some protocols for cancer treatments. Not all cancer should be treated with ketosis, but a good number of them can be supplemented with ketosis. Again, always ask your doctor, always work with your doctor, especially if you're a cancer patient. You need to work with your oncologist and your other doctors. Fighting diabetes, people have used ketosis to work on their diabetes with the help of a doctor again. And then, so finding your optimal range, where you feel the best at, and what makes you, feel the most alive, have less inflammation in your body, sleep really well, be in a good mood, is really going to be trial and error. Some people are going to easily get into high levels of nutritional ketosis, and maintain something like 1.5 to 2 millimoles per liter without much effort. I happen to fall somewhere in that category where I can get into a 1.5 pretty easily, and that's kind of where I feel comfortable. Some people are going to hang out closer to 1 or maybe even closer to 2. It just depends. But whatever you feel more comfortable at is going to definitely be up to you. And, it's a good way or reason to test a little bit more frequently sometimes to see, hey, if you just were to notice that you happen to be feeling really well, things are going great, you have a great attitude, you are looking forward to each day, check your ketone levels and see where you're at, and then look at that and look at what you've been eating and start to kind of make some correlations between those numbers and the things that you're eating and how you feel. And that will help you kind of figure out what is your optimal level of ketosis, right? And, with everything, there's a season. That doesn't mean that things can't change. During the summer, when things get hotter, I start to eat less red meat and I eat more vegetables and greens, right? So that is going to impact my level of ketosis because my fat level intake is going to fluctuate as I'm eating more greens than I would during, say, the winter time when I'm probably eating more meats. Again, so if you really want to dial in your ketone numbers, you need to use a reputable blood ketone meter or a very highly, not highly priced, but a really good breath ketone meter.